Welcome to the Weird Works podcast. I'm Dr. Kristy, your host. Join us for conversations about alternative and sometimes controversial healthcare topics. This podcast will provide the evidence that you need in order to make informed decisions about your health, to empower you with the facts that you need to advocate for your health, and to encourage you that there is hope your body heals. Join us from experts from all things weird, as well as the testimonies of people with stories of radical healing who were once told that perhaps their condition was a death sentence, that they would just need to live with it, or that drugs and invasive surgery were the only answer. Let's get into agreement that if there is something natural and non-invasive that could be helpful, that it could be your first option rather than your last resort. Welcome, everybody. This is an exciting topic. There's been a lot of buzz around it. I'm excited to be part of the launch of this new company. I think it's very timely because in practice, on a daily basis, we have always, forevermore, had conversations about metabolic resistance and insulin resistance and, weight loss and people being stuck. And we help people every day with that. But lately, with the nuance in a lot of marketing and push from the pharmaceutical company about Ozempic and other companies, I feel like it's very timely and important to have this discussion because regardless of what somebody decides to do, no shame, no judgment, I always want to make sure that you have the information that's critical to make smart, educated decisions. And so, I just want to empower people really and give them information. And also, how cool for our people who maybe are tempted to use those medications to get them past a certain stuck point, but resistant because we tend to be the population of people who are least likely to dip into the pharmaceutical world, that there's something groundbreaking and new and all natural as a very great alternative. So that's what we're going to talk about tonight. So the company is called MakeWellness, if you've been seeing some of my posts. And if you're on the call, this is for you. If you yourself, somebody you know, a friend, and or a patient, because we have a lot of practitioners and health coaches. We've got some people from the medical world on the call today, nurses, all sorts of different varieties. And so if you know anybody who can't lose weight or who has had trouble building muscle or has had a significant muscle loss, maybe have been tempted because if there's a lot of marketing, women my age and older and younger, like really starting in their 20s and on up, are very heavily being targeted for these medications. There's celebrities and influencers that are behind this stuff. Like pretty much everywhere you turn, you see these class of medications being just talked about. And I understand, like we were talking with somebody in the office just last week and she's like, yeah, no, I'm talking to somebody, my neighbor across the street, and like I'm looking and I'm watching her disappear, before my eyes, and she's lost 40 pounds. And like naturally you're going to be curious, like, well, tell me what you're doing. And so I'm trying to talk people off a ledge and provide alternatives before they make the decision. But if you have made the decision and you are on one of these meds, no harm, no foul, no judgment. But I still think that you can benefit from some of the new products, because what we know is that people aren't really having success getting off the medications or maintaining their weight loss and what they were hoping would happen once they get off the medications. So this call is for you if you think that your inability to lose weight might be related to hormones. You guys can put your hands up. I don't want to call anybody out, but if anybody is like, this is me, you could give me a hands up in the chat so I know you're listening and I'm talking about the right things here. If you've tried everything under the sun, right? So like we have a whole category of people in the practice. It's not because they're not trying, and it's not because they're not dedicated to doing what they need. If you've seemingly done all the right things as far as diet, supplements, exercise, healthy living, clean living, and you still can't lose the weight, this call is for you. If you want to know what's next, if you've already taken a semaglutide or tirzepatide or something related, this is for you. Also, if you just want to biohack, I went backwards. If you want to biohack your DNA, like a lot of us are just nerds and want all the science. And along with that is if you just love product research, that's my favorite part of my job is researching products and finding things that are working. Sometimes they're things that have been around forever. A lot of times they're things that have been around forever that have worked and always worked. But like this product, sometimes it's new and groundbreaking and revolutionary, and we get to be at the forefront of it. So hopefully we got the right people on the call. And then also, if you know anybody who needs to be on here, please share the link with them or share the replay with them as well. Okay, I was just checking in on the chat to see if I needed to answer anything. So you guys can keep the questions coming. And if I can't find the answers, I will get you the answers. So I think we need to start by just defining peptides and understanding what they are, because there's a lot of buzzwords around that. So you can think of it, your DNA, which is the instructional code for life and for your body. Think of that as a lock. And then peptides are these small little things like the key. And so you need the key to unlock the lock for the DNA to have its full expression. And so we're going to talk more about DNA and how that works. So peptides, they're natural. Like I really definitely want to make a point of making sure everybody understands, like these aren't new. They're not medications and prescriptions. There are synthetic versions that are being made into prescriptions, but peptides are literally just small proteins. So the very last bullet point explains that they're a combination of somewhere between 2 to 40 amino acids usually. And then if it's anything more than 40 to 50, it's considered a full protein. So these peptides are naturally in the body. Some people say that science has at least been able to identify 7,000 peptides in the human body. And then other sources say actually there's more, like 300 to 400,000. So again, like science, they don't know everything. And once we found things that are working, they're going to keep researching to try to name and define and find other codes that are already existing in nature. They're in plants, they're in animals. And so when we talked about that lock and key mechanism on the last slide, what peptides do is they turn, your DNA is just inactive information strands, but the peptides is what either turns them on or turns them off. So a lot of times we've talked about, like we've brought in nutrigenomics into the practice, and we've forever told people that just because your mother, your father, your cousin, your distant relative has a known disease or condition, that you don't have to rewrite history, that you don't have to become your genetic code or your hereditary, that through diet and lifestyle and proper living and sleeping, doing all the right things, that you can turn these genetic expressions off. And it's actually these peptides that do that. They help upregulate or downregulate certain genetic tendencies. That's really powerful. They're these tiny little things. They're natural, and they have the power to literally turn your DNA on or off. And so what that does is it prevents bad copies of DNA from being copied over and over and over again. And so they're not that uncommon. I'm going to show you that a lot of these are peptides that we talk about all the time or that we supplement. Glutathione. So glutathione is a very high-powered antioxidant that we use and supplement. As we age, we make less of it. While we're talking about metabolism and weight loss, I think insulin is probably one of the most common. Sometimes people need to take insulin if their pancreas is so far gone that they're so not making it to control their blood sugar, but that's a natural peptide in the body. Creatine is a peptide that helps make muscle. So a lot of people who are familiar with the gym and training will take creatine powder and supplements. Collagen, you guys know I'm a big fan of the liquid collagen. We use it in the practice. That's another big biohack just for anti-aging. We actually lose 2 to 3% of our collagen every year after our 20s, and sure wish that a medical doctor would have told me that that would be something that I should pay attention to before I was in my 40s. But we love our liquid collagen. Melatonin, so really commonly used for sleep. It's something that's naturally made in the body. And then two that you might hear less often of, but they're important. Vasopressin helps control our blood pressure and fluid retention in the body. And then oxytocin is thought of as the love hormone and helps with, a lot of times with mom and baby bonding, especially during breastfeeding, but adults use it also for bonding and forming relationships. So these are things that are common that we hear of all the time. They're not foreign, and again, they're not prescriptions or medications. I saw Claire's comment. I know. He's still barking. Can you guys still hear him? Because if you can, he's going to be on the recording. I hope he's not. Okay, so what we have access to through MakeWellness are called precision bioactive peptides. And we're going to break that down a little bit so you can understand how these are a very therapeutic format of what we want to use. So these precision peptides, they carry out normal physiological correction of body functions and cell rejuvenation. So remember, they're like the little messengers. They go in and find out what's going on and give body signals to correct it. They're organic substances in nature, and they help our cells work properly, allowing the body to heal and just perform at optimal levels. And so they're very precise little mechanisms and very precise biochemical pathways. And they have a targeted action. So the bioactive precision peptides are designed to interact with these specific biological pathways, like that lock and key mechanism. And so they're very targeted, and there's lots of different peptides. So you might start to get confused as we get talking about it, because in medicine, they just talk about GLP-1, but there's more than just that. And remember I said there's 7,000 to 300,000 in the body. And so science is still very much figuring these things out, and the specificity, lock and key, they're developing and finding more keys so that we get targeted therapeutic effects on various different systems and things in the body. And we're going to go over all the things that peptides are capable of doing. And then it takes cofactors. So cofactors is what we do on an everyday basis with nutrition response testing and with your therapeutic programs, utilizing vitamins and minerals, herbs, and different support products. Then they actually activate the peptides. So when we learn about what these different formulas are, you're going to see that there's peptides and there's cofactors and vitamins and minerals and antioxidants, things that you're going to be familiar with in addition to these precision peptides. So here we go. What do peptides do in the body? So the first thing is faster recovery. So some of these signals, specific peptides, are responsible for helping repair tissues and muscles. So that helps us improve and help recover faster after workouts or also after injuries. So in the chat, as you age, has anybody noticed after you work out, your soreness lasts more than a day or two? Like it starts to take longer? Or if you get injured, and you kind of take a little bit longer to come back from it? I know I have, so I'll put my hand up. No shame. I know it happens. They can also help enhance focus. So, you know, as we age, unfortunately, there is a cognitive decline. A memory decline is natural. We can't remember where we put the car keys. Or I know if my husband tries to tell me more than 3 things in a row, I'm like, wait, I need to write it down. So it happens. And so these things can help you stay sharp and focused. There are peptides that help with hydration. So we're always harping on everybody to drink water, but it's more than that. It's your body's ability to utilize that water and absorb it and get it into the cells, and also the combination between hydration and electrolyte utilization. There are peptides that actually help improve fitness. And 2 of the main products are called Fit and Lean. And you guys, I think, like me, are going to have a hard time trying to decide which one you want to use first. And the good news is that you can use them together. But fitness means to us, everybody's different as far as their fitness goals. I don't mean that everybody needs to be CrossFit and running marathons and be ripped, but it's important just for general overall health and well-being that we gain or maintain muscle mass and strength. So it's not just all about how much muscle we have, but how strong that muscle is. And then also burning fat. So we want to gain, maintain muscle, and lose and burn fat, which means if that's all happening, that our overall metabolism is working just with better, it's better equipped. Energy levels, anybody need more energy? It's so funny because everybody thinks I have a lot of energy, and I do because I'm passionate and I love what I do, but I'm like, I could always use more. I think I'm an energy junkie. But when we're talking about boosted energy levels, this is through your body's own natural production rather than artificial stimulation. And I don't, I think our audience all knows, we wouldn't be a fan of energy drinks and artificial stuff and caffeine and I don't even know, name an energy drink like Bang and some of these other things. But you guys can also be using supplementation like B vitamins to boost your energy levels. And while that's more natural than some of the synthetic things that are out there, it's still an outside-in approach where ideally, if your body, through your mitochondria and through your ATP production, could just have its own natural, sustained energy source, that would be ideal. So there are peptides that do that. There are some peptides that have a calming effect. Who needs to be calmed down? So I want to be energized in the day and calm in the night, right? So calming means having a soothing effect on the nervous system. That's that balance between your fight or flight, which is your sympathetic, and then your rest, digest, and repair, which is your parasympathetic. The calming effects also would be really important for mental health, and we know that that's always been a really important topic, but post-pandemic, it's definitely mental health issues are on the rise. We see it more as a priority in the practice on a daily basis. People are just, I think even pre-pandemic, people were already kind of overwhelmed and on edge. And then post-pandemic with family and kids and all the things, businesses and money and all this that's gone on, we're just on overload. So everybody needs to get out of fight or flight in order to be able to put in a healing state for all the good things that we're already focusing on and doing to take effect and really be impactful. And so continued actions of peptides in the body, they do a lot. I mean, they literally signal your DNA and your cells and all your biochemical processes, repair and growth. So there are peptides that help stimulate your body to produce collagen. So it's one thing to take collagen, but wouldn't it be cool if you could actually make it? And that improves the elasticity and healing. And then when we go down to anti-aging, it's going to sound a little bit redundant, but that's the fine lines, wrinkles. People talk about chicken skin or the flab, the jiggle under the arm. That's because of a loss of collagen, hormones, and hydration in tissues as we age. And peptides can help reverse that. They help with the cellular communication. Cellular communication doesn't get a whole lot of press from a patient standpoint, but practitioners understand that because that's just the ability for everything to be in biofeedback and be in connection with everything and just running smoothly without interrupt or without delay. So that's from everything from wound healing all the way up to hormone balancing and level 1 and 2, liver detox, a lot of different things, pretty much everything. Your metabolism. So we talk about metabolism, and I think everybody understands that is related to the ability to burn fat or keep your waistline trim. But your metabolism also is burning calories, having efficient energy systems, your feel-good ability to just operate the way you're supposed to. Immune support. So we all know, especially this time of year, kids are back to school. We're getting into fall and winter months, and all the little germies are starting to circulate around again. And of course, coming out of the pandemic, there's been a huge push and increased understanding and awareness of the importance of nourishing your immune system. And so what these peptides do on the immune front is help produce antibodies and then other immune helping cells like white blood cells and lymphocytes. And then lastly, reducing inflammation. So inflammation, if you're ever stiff or sore or swollen or red, that's inflammation. And so these peptides can help reduce the soreness and swelling and speed up recovery regardless of what we're trying to recover from.
Are you tired of going from diet to come up short and feel worse than you did when you started? Or are you just lost with all the mixed messaging out there today and not sure what's best for you and your lifestyle? Maybe you were told that you had to live with your symptoms and accept feeling less than your typical vibrant self. Well, I'm here to tell you the truth. As a practicing doctor of chiropractic, kinesiology, and clinical nutrition, I see people all the time that are just like you, frustrated and starting to lose hope. But I do want you to know that you do not have to give up on the you that you know you could be. There is a way to truly achieve optimal health and also to live your life. I want to share with you how, by doing some small, doable adjustments and taking on a new approach to enjoyable and non-restrictive eating, we can help you start feeling better and begin to see changes in your waistline and start releasing weight in as little as 14 days.
So I think it's important to talk about the difference between synthetic peptides and bioactive, because I think it's hard to kind of know what we're talking about here when we're talking about this brand new revolutionary technology. But before this, all the information about peptides was about the Ozempic and Wegovy and Manjaro and all that kind of stuff. So synthetic is what the later of what I just said, meaning they're made in a laboratory. And bioactive means made in nature. So just a recurring theme in my practice and over the last 20 years and our discussion as far as like what to incorporate into the practice and knowing what we put our stamp of approval on and how strictly we scrutinize products, it has a lot to do with this first table, meaning laboratory made versus nature made. And so like lab made synthetic or isolates will never be able to completely hold up to what nature has already made and created. It's always going to be a mimicker or an imitation of what is natural. And when that happens, our body doesn't respond the same. It's always going to lose its effect and it becomes more unstable and therefore the side effects come along with it. So that's what we're seeing a lot with these bioactive precision peptides is that people are being able to use them and get all the benefits with all the negative side effects. And the side effects of the laboratory made are not, like some people take them and they're fine and it's a miracle and I'm grateful for that they are not having these issues. But there's literally lawsuits out there. We have colleagues who work in emergency room departments across the country, and they're saying it's literally on a daily basis where there are serious illnesses and consequences coming in from the overdosing and misuse of these GLP-1 agonist medications, and even death. There have been people who have had bowel obstruction. Gastric paresis literally means paralysis of the gastrointestinal lining, the stomach and the intestines, so things don't move through. People have had to have a bag in order to poop. Like, it's not a risk worth taking, especially if you're somebody who already has GI issues, if you're immune compromised, if you're chemically sensitive, which a lot of our population is. That's often how people got to us in the first place, is because they aren't good candidates for medicine because they are the one that's going to have that rare published side effect. So another big difference between synthetic and bioactive is that these natural versions, they don't require a prescription. They are not requiring a needle. You can ingest them. A lot of them are either a powder that you mix in with water or a capsule or drops that you put on the tongue versus injectable. I know we have a couple of people who have been like lucky enough for insurance to cover some of their Ozempic and like similar prescriptions, but they're very expensive if you're not being covered for it. Whereas these Bioactive are very affordable. We're excited about it. I'm always excited when I find something that's revolutionary and, fits the bill as far as a missing piece in what we already can offer people. But then I'm also excited when I feel like it's reachable, like it's something that people can easily, affordably add to what we're already doing, and they don't have to give up something else in order to implement the goodness of these natural peptides. Synthetic, it is complex, like as far as knowing how to dose it. I've been hearing literally horror stories about young people who haven't tried any diet or lifestyle modification, and through a simple telehealth appointment where the person, the practitioner doesn't even really know them or do any kind of evaluation or exam, writes a prescription, mails the prescription off to the person, and they get it with somewhat of a guideline. And basically, if they don't lose enough weight in the first use of injections, are told to double it week after week. And that can be super dangerous. And so with Bioactive, because they don't have all the side effects and everything, it's very easy to implement and dose. We don't need a doctor. There's no crazy charts and stuff like that. We talked about stable versus unstable, and then side effects compared to like when it's natural. It's like anything, like even a supplement. Like if we just said vitamin C, for example, when it's vitamin C from ascorbic acid, that's only one isolate of the entire vitamin C molecule. And most vitamin C over the counter, at least when they're really cheap, affordable type supplements, it's just ascorbic acid, and so people can have bowel irritation and diarrhea and stuff and it's easy to overdo it. Whereas if it's a vitamin C complex from acerola cherries and from camu and from natural things, and it has all the other cofactors to make that vitamin C molecule absorbable and utilizable by the body, it's harmonious with the body processes. The body doesn't think it has to now like detox it or recognize it as a foreign substance and, use a whole lot of energy in order to be like, what in the world is this thing? So that's the difference. So the company is coming out with 6 different formulas. Like I said, initially, the first 2, fit and lean, are really what we're going to want to focus most on as far as healthy substitutions for GLP-1 agonists and for the weight loss. But the other ones are super great, and I just want to share a little. But as you can see on this slide, there's going to be a lot of science. I'm not going to go over all the science. If you guys sign up on the early launch list to get all the info, this is what is being released on a daily basis and weekly basis from the company. And so you guys, depending on if you're a practitioner or a coach or just a patient who likes to nerd out and do a lot of research, this is available to you. And there are scientists who do product calls every Thursday. There's lots of stuff and lots of goodness, and we can't share anything with anyone during this pre-launch phase unless you're on the list. So I'm going to share that at the very end if you're not already on it, or however you found out about this call, you'll be able to go and find my posts that also have that link. But feel free to reach out. But I definitely want to make sure that you guys get on the list and get all this nerdy stuff. But basically, you can just see how much science is behind this. So it affects all these metabolic processes. It affects the DNA. It affects ATP. These are methylation donors. I know a lot of our patients know about MTHFR and the like. So it actually supports stuff like that. So this FIT product is for improving muscle. So, people always ask, like, is this going to act exactly like a GLP-1 inhibitor? The answer is no, because it's not a GLP-1, it's not a medication, but it is going to help your body get the targeted desired tissue and stimulate your body's own natural GLP-1 pathways. That's always the difference with the natural. So fit, it's going to help increase muscle protein synthesis, but also reduce protein breakdown. So as we age, we naturally lose muscle. And so this is going to help reduce that loss because there's a lot of disease processes that have to do with muscle loss. It's also going to reduce exercise-induced inflammation. So it'll help with that muscle recovery and activate proteins that are vital to cellular functioning. So the whole thing with muscle, like sometimes we get into it with people because they're like, well, I don't want to be a bodybuilder and I don't work out to like because of the way I want to look. And I'm like, well, same. You know, the waistline and the muscle tone and looking trim is really the side effect of getting your body in the right homeostasis and balance. But what is important as we age to realize is that our muscle tissue is more metabolically active and does more good things for you than our fat tissue. The fat tissue is really just like unstable tissue. It doesn't do a whole lot for you. It doesn't burn a whole lot of calories. And in effect, what it does is stores toxins and stores a buildup of hormones and causes imbalances. So the basis is like if you could just increase your muscle and decrease your fat, overall, your fitness and wellness is going to be better overall. And so this fit product is what does that. Okay, so that's the first one. And then this is all the clinical data. So there are white papers, there have been human trials, people have gone through this already, and they've already been able to make claims and do print clinical material. And this is different. Like Ozempic, there's up to a 40% decrease in muscle tone with people that take Ozempic. A, if they're overdosed on it, and B, if they weren't counseled on the importance of a high protein diet and muscle training at the same time. And a lot of people haven't. Like when I was telling you about the young women who are just using telehealth and on a simple, intake are being mailed a prescription, those girls are not being counseled at all about doing the lifestyle part that goes along with it to reduce the known and published side effects of taking Ozempic. But the opposite is true of these medications. They've actually, or these peptides, not medications. So a 54% reduction in lean muscle loss. So you stop losing muscle on this. A 60% reduction in muscle atrophy and inflammation. So when you work out, you can work out harder and train and get more gains without hurting and breaking down your muscle tissue. 144% increase in muscle strength and recovery rate. And so I kind of alluded to this, and there's a lot of really good research out that it's not just about the muscle mass, like the amount of muscle you have, but how strong the muscle is as far as like longevity and anti-aging statistics. So this fit product actually helps make sure you get more and it's stronger. So check done. I love it. 47% reduction in muscle fatigue, 54% increase in performance. And then these are some of the nerdy science things that that they use to back up the data. Lots and lots of science. So that was fit. And then the second product that we're super excited about is called Lean. And this is the one that actually helps your body break down and lose fat. And so all these pathways, it's really cool because the gut is a big part of it. That's why, by the way, a lot of the side effects, the undesirable side effects of Ozempic and the like are digestive, is because of this gut-brain axis. And so the medications are shutting down the natural digestive processes so that people don't feel hungry. And so they don't, this leptin and ghrelin, those are hormones that signal your body to be hungry when it's appropriate, and then also signal satiety, meaning the feeling you're full after you eat the appropriate amount. There's hormones that like regulate that very tightly. And so the meds literally shut down those pathways. And so people are like, yeah, it's great. I'm never hungry. And of course they're losing weight because basically their body's never giving them the signal to eat and they're starving themselves. So what they're losing weight by is a serious calorie restriction, which isn't healthy and isn't sustainable either. So lean actually helps balance your body's natural hormone production so that when you eat, you'll feel full. And when you need to eat, you'll feel hungry. And that balances out your body's natural insulin and glucose mechanisms as well. What's cool is if you read down further, that's going to help your body break down triglycerides. Triglycerides is something that a lot of, especially women, I always say women because our metabolism and the link with hormones as we age, perimenopause and menopausal hormone changes, make it really hard. Like there's a lot of healthy women who have good, muscle tone and fitness levels and are eating right, who can't lose fat and who can't get their triglycerides in their hemoglobin A1C to lower, regardless of all their efforts. And these peptides can help us tip the scales and actually get that handled for once and for all. And that means that it works synergistically, again, with what we're already promoting, with the supplementation and the healthy diet and healthy lifestyle. So it's just really going to help magnify all the attempts. So here's some of the claims and clinical trials of the lean product. So 100% of the weight loss in the clinical trials was from fat mass, meaning it wasn't because of muscle wasting. So it's really important. And then of course they took abdominal fat measurements and waist circumference, which both decreased significantly. There was something in here about trunk, like most of it was lost around the trunk. And so some of that, 65% of the total fat loss was from the trunk area. And that's usually people's like trigger spot, like the stubborn area where they're not able to lose it. But it's also like the waist hip circumference and the fat around the middle and women complaining about that inner tube where they feel like they've lost their waistline, even though it's like what we're focused on as far as our pants and how we fit in our clothes and how we feel about our body, it's also the most metabolically detrimental area where your body holds on to a lot of hormones, like estrogen builds up and toxin builds up. So it's really important to be able to lose that trunk fat. So cool stuff there. Menopause belly, yeah, exactly. The women call it the inner tube. And then because of time, again, I don't want to go through every single product, but this is their energized product. Again, it helps with mitochondria and natural body cellular production of ATP, which is our body's natural energy molecule. So again, you're building it up naturally. But they've learned with all the cofactors and synergistic blends that it's important to balance cortisol and support the adrenal gland. And to help with glycogen storage, which is where our body turns glucose into stored glycogen and turns into fat in the liver. But it helps with increased alertness, reduced fatigue, and it's sustained release. So that's cool because unlike caffeine and some of these energy drinks, usually there's like a spike and people feel amazing and then they crash harder than they came up. And then it requires more and this kind of like blood sugar roller coaster of up and downs throughout the day. So this is a sustained release energy product. And they just sent out samples to the top 50 recruiters in the company right now during the pre-launch, and they're all loving it. Like the testimonials are fantastic because none of us want that like spike and thready energy and anxious energy feeling, but we want to feel alert and focused and have the endurance to get through all the things. And that's what this product is doing. And then you can see there's good claims and clinical trials and all of that as well. The fourth product is focused. So energy and focus kind of go back and forth, but this more modulates healthy dopamine, serotonin, and the neurotransmitter aspect of it, which is really important and fun because as we've been doing more of the functional medicine labs in the practice, we're able to break it down that far. Like, okay, does somebody have more trouble with energy production in the mitochondria and in the liver production? Or are they having more trouble over here in methylation and having the cofactors like SAMe to produce dopamine, serotonin, and norepinephrine? So they're different pathways, even though some people are like, well, if I had energy, I'd feel more focused, or, feeling like they're interconnected. But it could be completely different yet related biochemical processes. So like, you guys don't have to understand it. It's so nerdy. You don't have to be a biochemist, but I just like to put this up here so you can understand the integrity of the company and understand from my point of view, like, this isn't just another trendy thing that we're trying to bring in. Like, I'm very impressed with the science and the research. Like, this has very promising impacts on what we're trying to break through for patients who feel stuck. And the ability to just go deeper when we talk about root cause medicine, like, you can get all the way down to the DNA. And again, here's some of the claims and clinical trials on the Energized product. There's one for hydration. So this has to do with fluid balance. And sometimes this is like kidney, lung, and blood pressure has to do with proper fluid balance in the body too. So it's not just like hydration, meaning like you feel thirsty, but how many people talk about drying out? Like, as we age and we lose collagen and we lose stem cells and we lose estrogen as women, those are all very protective for our connective tissue. And so this product can help with that, like dry eyes, dry mouth, dry skin, dry hair. Like, I think a lot of times in peri and postmenopause, like, people just feel like they're turning into a prune, like everything's drying out. This product helps on that level. And again, all your clinical trials and everything on how it works. And then the last product, the sixth product, is called Calm. I know I could use a little more calm in my life. And it affects oxidative stress pathways. Again, another one that helps with cortisol. We talk about cortisol because almost 90% of our patients are adrenal fatigue, or some kind of adrenal priority has shown up at some point in peeling back the layers of their healing. And then it turns on different genes, like your COMT gene and GAD1. So that can be helpful. But also affects like the brain waves. So people who can't sleep, like, that's a big, as we age again and hormones change, inability to fall asleep and then stay asleep uninterrupted is a big complaint that we hear of on a daily basis. And sometimes the normal stuff helps, like melatonin, or, sleep hygiene, balancing out the cortisol, the 24-hour cortisol cycle. There's lots of things that we have to help support sleep. But again, these products aren't necessarily for people who are just starting their health journey. There are people who are stuck, who are seemingly doing all the things and not getting the result that every single other person gets. Or like me, I can't take a lot of the supplements that are meant for calming, which can be frustrating because, like, that is one of my challenges for my overall health perspective. And I don't muscle test well for melatonin, L-theanine, that helps like calm brain waves. There's a lot of things that don't, like, even some of the essential oils that are published to help with stress don't do well with my body, and sometimes even have an opposite effect and make me feel more anxious. So the peptides, again, are the signaling molecule. So instead of trying to take something to force our body to go into a sleep state, this would help your body's natural rest and calming and parasympathetic nervous system pathways in the body just do what they were intended to do, because it's just a signal. And here's some of the efficacy and support claims for that sixth product. So all the scientists are so funny, because, like, you think sometimes the science people stay in the science lane and the marketing and the sales people stay in the marketing lane, but even the science guys are so excited about realizing what they've uncovered and how revolutionary this is. They're calling them next generation nutraceuticals. And so these are just some things about why we decided to partner with Make, if I haven't made it clear already. But they really focus on efficacy and safety. They're very intentional about what formulations they use and where the products are sourced from. They're minimalist. So if it's natural and it works the way it was supposed to, you shouldn't need a gazillion different ingredients in a formulation. So they're trying to be minimalistic about what's in them and very targeted, so that you could take one without the other 5, or you could combine 1 or 2. You can take all 6 if you need to. It wouldn't hurt anything. But I think I think if we really were able to help you and do a health history, we could help you decide which 1 or 2 that you needed, honestly. And then they know how to formulate it to have all the necessary cofactors and coenzymes and molecules to make it enhanced, so that your body recognizes it and knows what to do with it. We talked about how it's very targeted as far as specific biochemical pathways and genetic mutations and biological reactions. And it's endless too, because like I told you, some people have said that we've only discovered 7,000 of the predicted 300,000 to 400,000 peptides that are in the body. So science is like, they're going to be able to figure out more and possibly come out with more than the 6 products that we have. But I feel like they were really good about picking the 6 major complaints that most people come into health practices looking for a resolution for.
Your health and how you feel on a daily basis directly impact your mental, emotional, and spiritual health. We will help you reprogram your way of thinking and be on a plan that works for your body instead of against it. It is time to rewrite the false belief that health abnormalities are normal and that it just is what it is. You do not have to live with feeling less than 100%.
We invite you to take a serious look at how you feel on a day-to-day basis. Is what you're doing working? Do you want to learn how to live a more holistic life that's still enjoyable and fun? The 90-10 lifestyle can be the bridge from subpar results to the vibrant and abundant lifestyle that you've been looking for. So click the link by this video so you can get started today. We truly, truly know that this program can change your life. We'll see you on the inside.
And then going in alignment with why we feel very comfortable putting our stamp of approval is that MakeWellness, like a lot of the product lines that we have aligned with, they have their clean slate or never list, meaning that these are the harmful ingredients that will never ever be in it. And you can see there's anything from mineral oils to synthetics to artificial sweeteners to endocrine disruptors and seed oils, dyes, GMOs, formaldehyde, also to different preservatives, MSG, GMOs, maltodextrin. These are things that they will never put in there. There's also in this list some weird words, and a lot of these are stimulants, right? So sometimes cheaper products that don't have all the technology and the proper manufacturing processes, they want to make medical claims as far as energy and metabolism and weight loss. And so the easiest thing is just to put a bunch of cheap stimulants in there. So this will never have that in there. And you can kind of read this. I could message this to anybody if they want a more clean copy, because I know the font is really small on that, but that's a lot of things. And then just some more about the company. They have very strict manufacturing requirements, and these are like non-negotiables. They're FDA registered and inspected. The positive inspection reports. There is 0 violations on record. They only use NSF GMP certified facilities with good lab practices. Their formulation philosophy is as natural as possible. So again, I said these aren't synthetics, they're not prescriptions, they're already occurring in nature. We're just figuring out how to extract them and concentrate them and stabilize them in the body to get through the digestive tract and all the way to the cell and the DNA to have their targeted action. So they fit our clean bill. They're just peptides and amino acids, which are naturally occurring, unique, effective, driven by science. And their manufacturing requirements as far as the facilities, they carry everything right down from clean facilities to the type of equipment, making sure that there's no heavy metal. They, multiple times test for any kind of contamination. They have preventative maintenance. I always feel like anybody who knows to do preventative maintenance, whether it's their body or manufacturing or their car or anything, is smart as far as fitting my bill. And then they're scalable. So again, one of the common questions that people ask, and we're going to go over, we're going to do Q&A in a second. If I didn't predict what one of your questions are, feel free to ask it in the chat. I will check it throughout. But it's important to understand how it's different. So the number one question that I've been asked is like, well, how does it compare to Ozempic or GLP-1? Or how does it compare, I guess, is what people are asking. And it compares as far as performance and what people are wanting, why they go on the medications in the first place. But it's not a GLP-1 agonist because it's natural. So it's not the same thing at all, even though it's a better, more sustainable way to gain muscle mass and lose body fat. The GLP-1s, just so you know, it only affects blood sugar. It doesn't have anything to do with fat burning or muscle building. It's 100,000% just about feeling full so that you don't eat and slowing down the digestive process, which isn't good long term. And that's why all the side effects are gut related, like paralysis and obstruction, because it's exactly what it's trying to do. And then the second mechanism of action is stimulating insulin secretion to suppress the storage of glucagon, which is glucose. So if you don't have a blood sugar problem and you don't have an overeating problem, you're not a candidate for GLP-1 medications anyway. And what we're finding is like a lot of the people who are on these meds don't have diabetes or prediabetes, and the meds aren't working for them without mega dosing on them because they're not the target market for these meds in the first place. And then the mega dosing on it is what's causing the definite serious side effects. But not always. Everybody's different. So some people can take a small amount and have just as bad a side effect as somebody who mega dosed on it. So I think it's important to understand, like, this is not that. It'll help your body's natural GLP-1 process in the body, but it's not that. Okay, so with common questions, and we kind of alluded to some of these, but it's nice to just have it all in one place. Do I need a prescription? Absolutely not. These are considered supplementation. You don't need a medical doctor or prescription. Are these injections? They are not. They are ingestible powders and or capsules. We just talked about, will they work as well as GLP-1 agonist medications? And we say yes, because we're going to teach you also the diet and lifestyle and the sustainability to implement alongside of these things. But these will help somebody who's been stuck. So somebody who's seemingly doing all the right things, who's not getting the result they would expect for their efforts, this is for that person. They will not lose muscle mass. They actually showed that 100% of the weight loss was from fat and fat alone, and that people actually gained muscle mass, not lost it. Amazing. Do you have to take them forever? So that's such a cool point. And I was curious about this too, because I know I'm going to get asked it, like, how long do I have to take this? How long is it going to take to work? That kind of thing. Well, what the research is showing is that once it helps with reprogramming the proper cellular signal, you don't have to keep taking it. So with the medications, the synthetic version, it's considered that you have to cycle on and off of them. And a lot of people are having trouble getting off of them permanently without rebounding as far as weight gain. And you're not supposed to take them forever, but people are having a hard time getting off of them. So with the Bioactive precision peptides, when they actually fix the cellular signaling issue, and correct the problem and fix the genetic mutation and turn off the bad copying of the bad DNA, that you don't have to take them forever, which means it actually fixed the problem, which is such a cool thing. No, you cannot eat whatever you want. So we're still encouraging that you follow a healthy diet and lifestyle, because that can cause other issues if you're, eating things, synthetic things that are encouraging inflammation. Like, you just be working against yourself. So why would you want that? But the good news is, I think that what we're going to find is the body's going to give people a little more grace, where before, people were having to, in order to bypass this metabolic resistance and insulin resistance issue, that people were very heavily, me included, having to macro cycle and count carbs and really keep track of like macros and really do a lot of metabolic confusion and a lot of like sciencey data tracking and stuff, that I think that the body is going to start to give you a little bit more grace, where you can implement a healthy diet and lifestyle and find what works for you, which will be different and individual to every single person. But that, like, having some sourdough bread or a birthday cake or a glass of wine isn't gonna like unravel all your results all of a sudden and have to start all over again. Can you take more than one of these products? Absolutely, they are stackable. The Fit and Lean especially can be used in combination. Of course, we can consult with anybody as far as where to start or what to take. So just let me know if you want more of a one-on-one. And then, when can you get started? So that's what I want to go over with you guys tonight. This is still considered the pre-launch period, and more info is still being released on a daily and weekly basis. They're doing that on purpose because there's a lot of competitors and copycatters out there. Peptides and GLP-1, you guys, that's why we're talking about it and getting out in front of it, is so popularized right now. And so there's a lot of companies that don't have all the manufacturing and understanding and science to create these stable things and have them be as targeted. So the company is definitely not going to lead with their ingredient list and put it all out on the internet for people to, scrap up before they even launch the products. But if you guys do get on the pre-launch list, and I'm going to put the link in the chat here in a second, you guys would be the first to know, and you'll be able to get product before anybody else can get it. And so the founders boxes is what they're calling. You can buy all 6 products starting on October 14th. You can put your, You can put your order in as early as October 14th. We're told it's going to be around $500 to get the founders box, which is all 6 products. I'm going to definitely be doing that because I want to have it in the practice so that I can make sure that I have it to muscle test and we can start using it and sampling it and give you guys our own testimonials. But there are plenty of people in the company already using it and posting their testimonials all over the place. So, and then we can share data. So if you're not on the list because it's in pre-launch and they don't want the info falling in the wrong hands, I can't share any of the calls or any of the data or the videos as they're released. So I'll give you guys the link. There's no risk whatsoever. They're not spammy. I would never get you guys like on a marketing, I don't know, whatever. I know what everybody's always worried about, like signing up and giving their info away. But there's no obligation for anything. It doesn't cost you anything to get on the list. There's no obligation to sign up. There's no cost to sign up. There's no obligation to purchase anything. It just helps you be on the list so you have first access. So I'm going to stop the share screen so I can go find my link for you because I was not prepared. No, there's a question on here. It's my proud dad. How cute. Okay, one sec. Let me grab the link. Okay. Does anybody have any questions that I didn't answer? You guys are such a good audience. I love when we give, like, I go and speak out in the community, and it's it can be a mixed crowd, and so I'm just used to talking to you guys who already get it and love it. All right, copy link address. All right, here's the chat. Some of you are already on it, so if you're already getting emails from the company, you don't have to do anything more. If you're not getting emails from the company, you are not on the list. Here's the link in the chat. So once you get on there, there's a lot of good information. There's videos from Justin Prince, our founder, and just general information about the company. But scroll all the way down to the bottom, and there'll be a form, and it just pretty much asks you for your name, phone number, your address, email address, and that kind of thing. And once you do that, you'll get an email. Everybody's browsers are different, so make sure you're receiving it. Your emails will come from MakeWellness. So I know Kristen's on here. I'm going to call you out, but don't delete it or send them to spam. And you might need to check your spam just because different email browsers might block it, but it's from MakeWellness. And then they'll be sending out the calls and everything. I've mostly been communicating with people through Facebook Messenger and answering questions and sending out info just because there's a lot of private Facebook groups where you can get involved. You can get involved at any level that you want to. If you're a practitioner or a coach, or you're an influencer of any way, shape, or form, a lot of us are influencers in our own realm in some way. You will have your own share link, just like what I shared, so you can share that with people. Why not? You might get some free product. If you get 5 people who order the Founders Box on October 14th, you'll get enough commission and product credit to cover your own Founders Box. So everybody's different, like who you know and talk to. I wouldn't discount it because I think we all know 5 people who have been considering these medications or are already on it. And remember, I said if you are already on it and you're just wanting to know what comes next or how to get off of the meds, these Fit and Lean used in combination with the Ozempic and Mounjaro are helping people be able to get off successfully and then maintain results and maintain the skinny fat. Like, people are being really sad because they're losing pounds, but they hate the way they look. You can go on social media and see like people who have been on it. They're like, they feel like they have jowls because when we talked about like loss of muscle and collagen and hydration, that's what makes us tone and firm and plump and prevents all the sag. And when you lose all your muscle tone and collagen and hydration, sure, you weigh less pounds on the scale, but people are not happy with the way they're looking after they've been on these medications. And so we can help with those people too. And then I'll put this link and some other links in the show notes and stuff. And so, you know, as we get going, if this isn't something that you want to pursue or use your own share link for, maybe at least you can help my heart and share it with other people so that we can, I just want to make sure people are informed consumers and doing what's best for them. And they're going into any decision making with the information that they need to make an informed decision. So whether they go on these meds or not, I feel like they at least need this info. And gosh, there's a whole lot of people that are being influenced to do that. So you guys can at least join my little army of people doing that, whether you want to get product credits or not. Okay, I'm going to sign off. Good night, everybody. Have an awesome weekend. Yeah, you're welcome. Thanks for joining me. You're welcome. Good night, everybody.
Americans spend $33 billion every single year on diets and weight loss products, and yet diets have a 95% failure rate. These statistics and my 18 plus years experience as a practicing doctor show me the real dangers of a cookie cutter approach to health, and that truthfully, diets don't work. This is why I created the 90-10 lifestyle, for the people like you and me, busy and not willing to settle for less when it comes to our health and wellness. This program isn't just about feeling fantastic and or losing weight for good. It's a roadmap to upgrading your body and mind from the inside out, while simultaneously suppressing the inflammation and suppressing the guilt that often comes with a high stress, high expectations, and high performance. The number one reason the 90-10 lifestyle is so effective and easy to maintain is that it gives you back your willpower instead of forcing it.